Yeah.
Okay, ready to go.
Okay. Good evening, all. Welcome to this Mitcham Community Forum meeting. I don't think we have any introductions. Chris, do we have an introduction?
Well, if the councillors would like to introduce themselves,
Do we want to do that?
up to you, Chair.
Okay. Where do we start?
Well, so on my screen, top left, Councillor Allison, if you want to introduce yourself.
Yeah, hi, I'm Mark Allison, Leader of the Council and a Lavender Fields councillor.
Councillor Macaulay.
Oh, Councillor Edith Macaulay, Lavender Fields councillor. Thank you. Good evening, everybody.
So we've got Agatha.
Evening.
Yes.
Agatha?
Oh, sorry. Good evening, everyone. I'm Councillor Agatha Kajina, Figs Marsh Board.
Right. I don't see Councillor Fraser. Is Councillor Fraser?
He was here already. Sure.
Right. We've got the presenters. I think if we can introduce Leonie. Can you hear me? Leonie?
I can. Can you see me?
Yeah,
Hi.
I can see you now.
Hello.
It's
Hi.
just a brief introduction.
Hi,
Yes,
everybody.
so
My name is Leonie Cooper, and I'm the London Assembly member for Merton and also for Wandsworth. Lovely to see everybody.
When do you hear now? I don't think you.
I'm sorry, I just got cut off. I'm back.
Oh, you're back? Okay,
Yeah,
could you introduce?
I'm Councillor Brenda Fraser, and I'm Longthornton Ward. That's
Right. James, can you introduce yourself?
Thank you, David. Good afternoon. Good evening, everybody. James McGinley. I'm the Assistant Director for Sustainable Communities.
Good. Okay, I see some other names. If they can introduce themselves, Barry.
Good evening, everybody. My name is Barry Clauser. I am the Public Health COVID Lead within Merton Council.
Perfect. And then I see Susan. Can you hear me, Susan? Susan Crawford? She needs to unmute. And Father David Pennell?
Yes, I am here,
okay.
and I am a resident of Pollard's Hill Ward.
Thank you.
And good evening, Father David here, the Vicar of Mitcham Parish Church, Cricket Green Ward.
Perfect. Stephen?
Hello, my name is Stephen. I am Commissioning Manager for South West London CCG Cancer Services. So Nav is also going to be doing the talk from the same. He's a GP. He's just popped off at the minute because he's in between clinics and so etc. So, but he'll be popping back on the time of the agenda item.
Thank you. And Mark? Mark Gill?
Mark. Oh, yeah.
He's muted, so probably he's not hearing. Okay, and last but not least, I should have done it at the beginning. I apologize for that. I'm Councillor Chung, and I'm actually chairing the meeting this evening. If I've missed out anyone, could you maybe introduce yourself now before we move on? Okay. And of course, the officer responsible for conducting affairs for the Mitcham Community Forum, Chris, is actually there. Okay.
Yep.
Right, let's move on then to agenda item 2. And I'm going to ask Councillor Mark Allison to introduce his update. Mark?
Yeah, thanks, David, and thanks for inviting me. It's nice to be here and have a chance to talk to some residents. I'm here because I just wanted to update you on the last year and my views on how it affects Mitcham. I just want to start by saying that I think Merton's a really great place, and wanted to sort of talk a little bit about sort of my connection with the area, because I've been a councillor here for nearly 20 years, and I'm very proud of my area. I was born in St Helier Hospital. I've lived most of my life actually within a few hundred yards of it, and this is the Mitcham Area Forum. So when I moved to Mitcham, it was the furthest that I had ever lived from St Helier Hospital. So you know, I'm very, very proud of the area, very connected to the local area, and very conscious as well of what a great community Merton is. I think what we found over the last 18 months, even more so than probably before, was that Merton is such a great community in the way that people care about and look after their friends and neighbours. But I also wanted to talk about, you know, that there's some big challenges for Merton and for Mitcham as well. Mitcham is probably the most disadvantaged part of Merton. And whilst I would say that things have definitely improved during the first 18 years that I was a councillor, the pandemic has meant that in the last 18 months, things have fallen back a bit. And that's something that concerns me a great deal and affects probably my priorities for the future. So in the first 18 years in particular, our school results improved massively. The life chances of our young people are better probably than they've ever been before. I think when I first came to Mitcham 20 years ago, if you went to a Mitcham school, the expectation was that you probably wouldn't get any qualifications at all. Whereas now, I think it's almost the opposite. There's an expectation that you will be able to go to higher education if you go to a school in the Easter Borough in Mitcham. But as I said, the progress we've made in areas like education and health and other things does seem to have gone backwards during COVID-19. I would argue partly as a result of government policy, but also just that's the way that the pandemic has hit places, and it's hit places like Mitcham and Pollard's Hill. We've got a resident from Pollard's Hill. It's hit those areas really particularly hard. So I just wanted to tell everybody how passionate I am about lifting the life chances of those who need it the most. As I said, in my time as a councillor, I think we've made enormous progress. Secondary schools, they're all rated good and outstanding. We continue to provide full council tax support, one of the few boroughs in the country that still does that, to lift people up. And we've also overseen progress in things like, you know, there's been a new leisure centre built in the borough, thousands of new homes, a new library. We've got a great library in Pollard's Hill as well. And so, you know, we have been making progress. That is a priority. And I am absolutely passionate about being inclusive as well. I know that that Mitcham is a very inclusive community, and this is Black History Month. My wife and my son, they're both mixed race. I live in a mixed family, and all sorts of things, all sorts of events over the last 18 months or 2 years, from Black Lives Matter to the way that black footballers have been treated. All of these things have made me particularly passionate about ensuring fairness for all our communities here in Merton. And that is why I am proud that the cabinet that I appointed is the most diverse in Merton's 55-year history. So 2/3 of my cabinet are women, more than a half are from an ethnic minority. And as leader of the council, I intend to celebrate our great community in all its diversity. So as I said, I became leader last November. My first announcement as leader of the council was to launch Merton Together. When the pandemic began, it was very clear to me how many people in our great community wanted to help other people. They understood how important it was to look after our friends and neighbours who were shielding or isolated or struggling, maybe financially or in other ways. And at the beginning of the pandemic myself, I helped my wife with a food bank that we were running in Pollard's Hill. And I know several people here have helped out with food banks. And as well as the urgent need for help that we could see, one of the things that I was struck by was how committed other people in Merton were to helping. And through my work in the council, I've seen extraordinary efforts by so many people in our community. So that might be the Merton Mutual Aid Group, it might be the Dons Local Action Group, set up by the fans of AFC Wimbledon, which has just been tremendous. So we launched Merton Together, which was supposed to be a joint campaign with our partners across the community to come together to support residents who needed it. And I want to take this opportunity to thank everyone in Mitcham who got involved, and to say that the community's effort has made a huge difference. But the truth is that becoming leader of the council during COVID-19 has been pretty odd. We still can't meet in person. I was pinged just today. So if this had been an in-person meeting, I don't know whether I would have wanted to come, on the off chance that I am carrying the virus. And I know it's affected many people in those kind of ways. Just the disruption for me, but for other people being ill, has just been a tremendous drain on everything. And I think what we found through the 18 months that we've been during the pandemic is that for many people, things will never be the same again. I think that the council, working together with the NHS and all our partners, have done a great job keeping everyone safe. The vaccination has been rolled out, testing has been rolled out, but we have to reflect on the fact that because of the way this pandemic has progressed, sadly, some people have lost loved ones, and other people, not as terrible, but they've been affected in other ways. They've lost jobs or they've struggled financially. And I think we as a council are very, very conscious of that. Other people have been affected just in more everyday ways, but they're still significant to them. We've all had to get used to new ways of working, more working from home, less going to the office. And whilst for many of us that's been a good thing, it's certainly, meant that we've seen more of our family, more of our community, but it has certainly changed the way that some people in Merton run their lives. And that in itself has implications, big implications for an organisation like a council. And that is why, as a new leader of the council, this summer I launched a huge listening exercise across the borough. We called it Your Merton, because we wanted to listen to what you want from Merton, what you enjoy, what you don't enjoy, things you think work well, things you think we do well, and things you want us to improve. And Your Merton has probably been, if we look back on it, probably the biggest consultation that Merton has ever undertaken, with more than 10,000 interactions of people telling us what their priorities are, what they want in the wake of the pandemic. And we're still actually ploughing through the responses and working through the implications. But I think even at this early stage, it's fair to say that we can draw some conclusions. First of all, is that the people of Merton, absolutely, what they love about Merton is its community. That spirit that I talked about earlier of people coming together has really come through and made people feel that they're connected to a really lovely community. But also, you love parks and open spaces, which the council has kept open and in, I think, pretty good condition. We will spend much more time now in the area immediately around our homes than we ever did before. So I think that one of the things that's come across is that people are very conscious of their immediate vicinity. So, what their streets are like, what their high streets are like. And mostly they're proud of their streets, they're proud of their high streets, and they want to see what they like improved upon. But I just also wanted to say that I'm still very much in listening mode. However, I think that what's maybe come out of this and has helped us in some ways, I think already we're able to say that there are three major things that have come out of this listening exercise. First, I have heard, and we in the council as councillors have heard, loud and clear, that people are very worried about the cost of living And that is why we are not going to be raising parking charges after all. We've already seen good progress in reducing pollution, for instance, by introducing school street zones, of which we've got more than any other London borough. And so we do not think it is necessary to raise parking charges in order to get people out of their cars. We've also heard loud and clear that some people need better homes. If you'd spent the pandemic stuck in a bad, overcrowded flat, you would know the importance of living in a nice home. Many people in Merton do live in a nice home, but some people don't. So we are going to use the money due to the council to support regeneration. That will mean hundreds more affordable homes. And we've also heard that although Merton is still one of the lowest crime areas in London, now that we're spending more time in our neighbourhoods and our communities, we also want to feel more assured that these communities and these neighbourhoods are safe. And especially after the terrible things that happened to to people, in particular, we think obviously of Sarah Everard and the news about her, and Sabina Nessa, the terribly, terribly sad things that have happened. People want reassurance that they live in a safe area. So next week, the Cabinet is going to announce a £1 million upgrade to our CCTV service to improve the quality of the images that our CCTV provides and improve the capabilities of the system as well. Now, those are three things, but I think there will be more to come. We're still, as I say, going through the Your Merton results. And I don't pretend that everything in Merton is perfect. I don't pretend for a second that the analysis of what people have told us is going to be perfect. But what I do know, and I know this for Merton, but I also know it for Mitcham, people think that Mitcham is a brilliant place. We know that it's not perfect, but we think it's a brilliant place. And I think together, all of us in the community, we've done amazing things to keep our families and our neighbours safe during the pandemic. I think as a council, we've done great things. We've kept the parks open, kept the rubbish collected, made sure our children get a good education, despite all the pressures on them. We've even given some of them free school meals where they're eligible. So, I mean, I really do think that Merton is a fantastic place and a fantastic community. And I'm so proud of the way that everybody's come together during the pandemic. I mentioned earlier, I'm proud of the Don's Local Action Group. I'm also proud that we brought back AFC Wimbledon during the pandemic, just as one little thing to give an extra lift to everybody in the borough of Merton. So as I say, Mitcham's a great community, Merton's a great community. I hope that that's a reasonable kind of update of a number of things that have been going on over the last year. But I also want to say that I am here to find out more about your priorities and what you want and how we can make it even better. So yeah, sum it up. Thanks, David, for inviting me. And I promise that I'm going to do all that I can to ensure that Merton remains a great place for families and for people like our friends and neighbours who live in Mitcham. So thank you. I think you may be muted, David.
Okay, thank you, Mark, for that illustrious speech. I certainly can second it. I've been living here now for 30 odd years, so I should know. I'm sure there'll be people who might want to ask you a few questions. So I'm going to open the floor just in case anybody wants to ask any questions to you. Okay, Father David.
Hi, thanks for this opportunity. And Mark, thank you very much indeed for your talk, which is really, really important. It's good to see your priorities, particularly on the housing front, which I'm very aware of in my particular part of Mitcham here. But one of my other concerns is when we talk about parks and open spaces, we quite often actually neglect those areas which are just around, not so much the big parks and the common and all the rest of that, but in actual fact, and I'm sorry, I'm going to particularize this, to the graveyard at the parish church, which is under the council's charge because it's a closed graveyard, so therefore it's a council responsibility. And yet in actual fact, it's becoming very overgrown. The trees of heaven now are totally taking over, so it's actually making some of the pathways through this 6.5 acres, which a lot of people use, really quite unsafe. And I'd also like to attach that to just talking about footpaths and routes through. For instance, if you go down on your way to the tram stop at Belgrave Walk here, there's a very unsafe footpath, which I don't know if anybody has ever taken any chance of actually just considering, well, if this is a footpath which is supposed to actually connect communities, then we need to keep them sort of safe. Some of them are totally overblown by brambles at the moment. You can't actually walk on the pathways, so you actually have to walk almost on people's gardens to find your way from Hallerfield Way down to the tram stop at the moment. I do want to appeal that we can actually think about these small, what seem to be neglected areas, which are really important to communities and set a lot of the mould and the feel of a local community area.
Yes, thanks, David. I know there are, it's not just about the big set piece locations, with the borough of the Wombles, but it's not just about Wimbledon Common. And I think that one of the things that's really come out of the last 18 months has been the increase in usage of some of our smaller facilities, now smaller parks, and most of them are in a very good condition, and people have really looked after them and treated them respectfully. I don't know enough about the graveyard. I don't have, I'm afraid to say, much reason to go to the parish graveyard, I'm afraid to say. So I'll need to find out a little bit about what the arrangements are there and how that works. But obviously we do try and keep graveyard facilities as respectful as possible, because they're important to people, and probably even more important after what people have been through over the last 18 months. Many of us have lost people, and we need to have somewhere to go that's quiet and nice to reflect. So I'll try and look into that for you about your own graveyard. Some of the footpaths, I'm aware, obviously, of the footpaths going to the to the tram stops, and it's very difficult for some of these sites that aren't used very, some of these paths that aren't used very often and aren't overlooked really. And I think that's one of the things that maybe has come across in people's concern about safety. So I think that's got to be something that we look at in the future. But I don't really necessarily have easy answers to that sort of thing, especially in the dark. Some of the footpaths and some of the parks, people need to decide for themselves, but they're not necessarily the sort of places that you would necessarily want to go unless you had to at the moment. And we will need to work as a community to try and improve that and give the sense of safety. I think possibly the idea that there'll be more people living in that area in the future will help to to improve the sort of the flow and the sense of safety through it, because being overlooked and having a sense that other people are there as well gives reassurance to people. It's when you're on your own that things are most scary. So hopefully that will make a bit of a difference. Hope that helps.
Thank you.
Thanks a lot, Mark. Does anyone else want to ask any questions? Okay, Mark. Well, thank you for coming along and introducing yourself. We look forward to big and better things from you as we progress, and I'm sure we're going to see you quite regularly at this forum. If not, we will actually have to invite you.
Thank you, David.
Okay. So we move on now to item agenda 3, and I'm going to ask Leonie if she will actually do her presentation. You don't need much introductions, Leonie.
Well, that's very kind of you, David. Thank you very much. It's lovely to see everybody on the call. Actually, I've spent today in Mitcham, both in reality. I was actually out with a local business this morning, talking to them about how successful they've been and further enlargement and expansion that they might be able to undertake. They're one of the businesses down in Willow Lane. So I was in amongst all the lorries and the trucks and everything going on down there. And then I was on a call with Mark Allison and with some people from City Hall talking about important sort of strategic borough-wide issues. So I've had a day with a very local focus on the whole of the borough, but also being out and about in Mitcham, which was very nice. Particularly because obviously we are gradually getting back to having some things in person. I could do that meeting this morning because it was mostly outside, but obviously it is still quite difficult. So one of the things that we've still been looking at citywide, and we have some responsibility for some coordination across the whole of London is COVID. It hasn't gone away. It's still causing us difficulties, as we know. And there's been a new mayoral report has just come out, I don't know whether you've seen it, which shows that there's a link between exposure to air pollution and a greater risk of COVID-19 hospitalisation. And of course, if you lay that on top of things like deprivation, where it's clearer COVID has operated more severely on certain communities, including Black, Asian and ethnic minority communities, that is something that we really need to be bearing down on. So I'll come back to the issue about air pollution later on in my remarks. Another thing that is obviously, it's now gone out of the news agenda to a large degree again, but obviously took up an awful lot of time during August, was the situation in Afghanistan and the evacuation. And the mayor has, again, London boroughs have stepped forward and said, we're happy to help as far as we can. There are some boroughs where there is quite a large Afghanistani population already, so there's already quite a large number of people who've been going to those boroughs, and there have been some hotels in London where people have been isolating while they, just because they've just arrived from Afghanistan. So the mayor decided to open his right to buy back fund to help councils buy new homes for refugees, as well as using that for other Londoners in need. And we passed a motion in the Assembly welcoming the government's commitment to taking in 20,000 refugees and calling on the government to offer that necessary support to local authorities with additional funding to help and house Afghan refugees, because it's unfair to expect councils to step up and not to have additional resources. And the Mayor and London councils together have set up the London Refugee Response, working through the London Community Fund to help coordinate donations. And actually almost all of the groups across London that have been offered donations have now actually had to shut their books. People have been incredibly generous. And just earlier on, Councillor Allison was just talking about, the Don's local action team who have, award-winning now, in fact, because it's been such a fantastic stretch, and it's a very long stretch of work that they've done. The mayor has also announced a new £400,000 fund for community groups to continue to fight against hate, extremism and radicalisation. And this is going to build on the mayor's Shared Endeavour Fund, which delivered a number of projects across London that reached out to 600,000 Londoners. In terms of jobs, the mayor is developing creative enterprise zones, and those are particularly going to target training and mentoring for underrepresented groups, including Black, Asian and ethnic minority Londoners, disabled people and women. This fund includes £650,000 from the European Social Fund, which is of course going to be the last money that we get from the ESF, because we're not eligible to receive any money now because of Brexit. So I'm hopeful though that Londoners who are unemployed or in low paid work will be able to access some of these fully funded training places at local colleges and adult education providers. So just remind you that the Mayor holds the adult education budget for London now. There's also a package of £11 million focused on supporting Londoners into good jobs in sectors that are key to our recovery and long-term economic growth. £5 million is going to go through the Mayor's Academies programme, of which £3 million will support new academy hubs that are going to bring together skills providers, employers and other partners to help tackle specific skills gaps, and which we know have been developing. There's been a lot of talk recently about not having enough people who know how to drive HGV lorries. We've also got the same skills gap, and a lot of the lorry drivers are now older. We've got the same skills gaps that we know are there, for example, in the construction sector. A lot of people are older in the construction sector. We need to be training up new people who are going to be the carpenters, the electricians and the plumbers of the future. We had a plenary session where all of the Assembly came together and we focused on transport for London, and we asked both the Mayor and the TfL Commissioner a series of detailed questions. And one of the things that is very clear is that under the previous Mayor, TfL had a 5-year funding deal. And we've just had a whole series of these tiny sort of 6-month funding deals recently. The current one runs out in December. And again, it would be very good for TfL, for its stability, to have a longer term deal. So that's something that will need to be renegotiated yet again for about the 5th time. I mentioned poor air quality as being now having been identified in this report as being an indicator of problems that once combined with COVID and making COVID more severe. So we have the ultra low emission zone that was launched in the centre of London, that sits on top of where the congestion zone is at the moment. That is going to be expanding out to the north and south circular. The current ULEZ, the ultra low emission zone, has reduced nitrogen dioxide in London's air by 44%. And what happened when the first central zone was introduced, people started to change their vehicles in expectation of their need to, potentially enter it. And by the time it launched, compliance was at a reasonable level, and it's now gone to a much higher level. And that is the expectation with the expanded zone, is that people will decide to change their vehicles. And that will be very good, because that will mean that local people, and particularly children going to local schools, will benefit from better air quality, because obviously people are not going to have a very polluting car drive to the edge of the newly expanded ULEZ and then change into a new car. People just change their vehicles so they can come and go as they please. And we heard a lot from the Commissioner, as you can imagine, not just about that, because we were asking questions about it, but also about how TfL is doing its best to keep public transport COVID secure. And of course, the Mayor did introduce the requirement that people should wear masks, because if you're in close quarters with people packed into a tube for more than 10 or 15 minutes, that becomes an opportunity for the spread of COVID, because you can't socially distance. It is difficult. Some people are more reluctant to wear their masks, but mask wearing is still, pretty prevalent, I would say, having used the tube in the rush hours. It's not going to come north and south, that's Crossrail 2, but Crossrail 1, which has now been renamed the Elizabeth line, the trials are going well. I'm going to do a bit of a crossed finger here. I'm going to cross my toes as well. It has been delayed a few times. The problems have been in the software and making sure that where the trains stop at certain points down the track, that the doors of the train line up with the doors on the platform. Still looking for it to open in the early part of next year. So that has not moved, first half of 2022. So that date has not moved. So I suppose the first half of 2022 is sometime between January and June, but it hasn't moved. We passed a series of motions, universal credit uplift, which we felt should have been kept. Unfortunately, as you know, that has not gone ahead. We also called for fair pay for police officers. Their pay has been frozen. And we think that's unfair. There's a lot expected of them. There's also a lot of issues about the police that have come up at the moment, which some of you may want to talk about. And we also talked about London to be included in the Clean Air Fund. We don't have any access to it. It's only available to other cities. And we feel that's very unfair because that should be helping us locally in London to work on cleaning up our air. We passed a motion about Brexit and COVID and a permanent solution to the current food supply issues caused by those things coinciding, and also the motion on Afghanistan. We had motions on action on HIV in London, and one on the restrictions to the freedom passes, which a lot of people are not keen on, wanting that lifted, accessible streets, and one on a feasibility study into new walking routes. You may have noticed that the Mayor has made a housing announcement to fund thousands of new council and other genuinely affordable socially rented homes over the next 5 years. And so there should be 79,000 starts. And I'm hoping that we will see some of that money coming into Merton. And so I shall be pushing for that very hard. And of course, we will be looking for all the new homes to be environmentally sustainable. The Mayor continues to work on violent crime. The Violent Reduction Unit, 9 housing associations have just announced a new partnership to work jointly to push down violence. And also there's going to be the development of mentoring support for young people. Violent crime started going up from 2015, just as the police force started to decline in numbers because of the cuts. And, there's still a lot more that we need to do to divert young people from crime. So that continues to be a major focus. I'll leave it there. Chair, thank you very much. I'm very happy to take any questions on any of that or anything else that City Hall is doing.
Thank you very much, Leonie, for that comprehensive report, as usual. I wonder if there's anyone that wants to ask any questions of Leonie?
Yes, please, David. I just want to ask Leonie whether the Mayor has any new plans about violence against women. What's his new plan of what we're going to do?
Yes, I mean, I did say that somebody might want to ask about that, and I'm glad that you did. I mean, we're in a situation at the moment where there's been a series of announcements, including this very week from the Home Secretary, saying they want to do lots of investigations and examination of what went wrong with the recruitment of the man that murdered Sarah Everard, and also the other man who also was in the diplomatic corps and who's just been charged with rape. So they were actually working in the same part of the Metropolitan Police. We've previously pushed the Mayor on violence against women and girls. He's been very clear in his statements that he thinks it's not just about the police, and that in one sense the way the police behaves reflects a wider problem in society, which, while I think that is true, and I think there is a lot that needs to be done in wider society, I think it's also pretty clear from my discussions with the borough commander for, the borough commander covers Merton and 3 other boroughs, and I meet regularly with the current one and have done with the previous ones. They have unconscious bias training in the police, and we've passed motions on saying that all police officers should go through this unconscious bias training at City Hall. But what I've discovered is the unconscious bias training is it's voluntary, which seems completely pointless to me, because the police officers who are, most receptive to the idea of challenging their own sort of internal attitudes about how they respond to violence against women and girls, how they themselves deal with their own feelings that, perhaps they need to be, dealing with themselves in their own lives. Perhaps how they respond to other hate crimes. I mean, we've actually got a very unpleasant situation where they also ignored a series of homophobic crimes committed by Stephen Port, and they were dismissed as a lifestyle choice. Well, who chooses to be murdered in a graveyard? Literally nobody. So there are a series of unconscious attitudes that the police have, and I need hardly talk about, their unconscious attitudes to Black people, because, that's what the whole of the Black Lives Matter movement was highlighting. So we know that the police have got these attitudes. We know they need to examine them. And I personally feel that, you know, we need to move forward with making this unconscious bias training compulsory for all of them, because otherwise the ones who need it the most are going to be exactly the ones that don't go on the training. So I think that's one thing. The other thing is there's been the whole discussion about should Cressida Dick go or should she stay? And neither the Home Secretary nor the Mayor are talking about her going. And I think there is a huge benefit to expecting this commissioner to step forward, the first woman commissioner of the Metropolitan Police, and to take on board the issues that have been raised as a result of the murder of Sabina Nessa and Sarah Everard. But also, I think there's about 3 women murdered every day in this country. You know, misogyny needs to be, I think, redesignated a hate crime. I think that has to be done at national level, but we have to expect the commissioner to start stepping forward and tackling this now. I think announcing a lot of inquiries, I'm slightly reluctant about all of that, because I think that will just delay things. I think now is the time to act. So that's something that we will be continuing that dialogue with the Mayor on. I suspect we will be seeing a lot of discussion at the Police and Crime Committee on these issues continuing. There was last week with the Deputy Commissioner, and the Police and Crime Committee is meeting again tomorrow. So I think, you know, come back to me, and if you've got suggestions of things that you want me to raise with the Mayor, questions you want me to put in for Mayor's question time on this issue, very happy to pick those up. It really needs to be taken forward now.
Can I just say that there's going to be suggesting internal investigation. Is there a chance of the Mayor trying to convince them not to have an internal investigation? There should be an outsider investigating, because internal investigation, looking at yourself, doesn't work. And this is a serious, very serious situation where we should actually be caring about what we're doing, not just covering things up. So if the Mayor can take it up, if your group can take it up seriously, that would be something that we'll be quite happy with.
Yes, we actually had a meeting with Sophie Linden this week privately, and we will be having further discussions privately next week, and we will be picking these things up with the Mayor. And I think you're putting your finger on why I'm slightly reluctant at the idea of having, you know, lengthy investigations and reports into what's happened. I think there are some things, you know, we need to move on now.
Good.
Thank you for that.
Thank you, Leonie.
Yeah.
Thank you, Chair. Can I ask a question to Leonie? Leonie, I'm sure you're aware that the criminal justice system has had a 28% cut in its budget. And this is becoming very, very important in terms of delivering justices in the court. We have seen that there is a backlog of over 600,000 cases which has not been dealt with. And both judges and magistrates are under great pressure in dealing with criminal justice cases in terms of domestic violence, abuse against women, you know, and these courts are inundated. We have been dealing with cases by remote control, and some of them have been dealt with, you know, trials have been dealt with, you know, just minimal because of COVID-19. Has the Mayor made any representations to the government? Because I think what the Law Society and also the Magistrate Association is doing, which I'm a member of, what they're trying to do is lobby the government to increase the sentencing guidelines in order that it will deter people from committing this crime. But what I need to hear from you, what is the Mayor doing in terms of the 28% cut in the justice's budget? Because Dominic, I mean, let's face it, Robert Buckland was a very good Justice's Secretary. I'm not too sure about Dominic Raab. So I would like to hear from you what you feel about that. Thank you.
Yeah, I mean, I think it's a very well made point. I mean, as you clearly recognise in what you've said, it's not actually the part of the criminal justice system that is actually under the control of the Mayor. So it is only something that he can lobby on. And, you know, obviously he has some public channels and letters that he can send publicly. There are also the, which we also can from the Assembly and do, but there's also the private channels which he uses, and the conversations both between him and ministers, but also between City Hall officials and Justice Department officials. And I think, you know, there's a widespread recognition by everybody that actually more money is needed now to go back into the justice system, because it is in a state of absolutely advanced collapse. I mean, you just talked about the massive backlog of cases, but also coming back to the very well made points that Agatha was just making, you know, that we're in a situation where only 2% of reported rapes, and that's just of rapes that are reported. We know that there's a very large number that go unreported as well. Only 2% of them actually result in a conviction. Now that is, and who wants to put their life on hold for 5 years and give up their mobile phone so it can be examined for 5 years and then have to relive an experience from 5 years ago? And that's about the length of time it's taken to bring these things to trials. So there's a lot of there is a lot of toing and froing going on at the moment in the lead up to the CSR, the Comprehensive Spending Review, because I think there is an absolutely widespread recognition, but it's also something that is very held very strongly in City Hall, that we need to now see some money going back into parts of the criminal justice system to actually make it functional again, because it's just not functioning. I'm very happy to take this offline if you want to share particular correspondence from the Magistrates Association or the Law Society. That might be something that we can specifically see if the mayor is or some of his staff are willing to put before the specific, to make sure that the points are being amplified precisely.
Thank you, Brenda.
Thank you very much, David. Leonie, this question is something that's bothering me. As somebody who's worked as a magistrate and as a police officer, I was really appalled to think that any police officer in their mufti, they're not in uniform, can stop anyone and actually arrest them and put handcuffs on. So what is being done to make sure the public knows who can and who can't stop you, and then you have to stop? Because that was really out of order. I did the training at Hendon. That was never part of it. If you wanted to arrest somebody, you have to call uniform. So you call somebody in uniform. How did that happen? That means the training is not being adhered to. And if you do training, why is it not being documented as to who has done it? So it's not a tick box exercise.
Yeah, it comes back to the point that I was making earlier, Brenda, that I think it's really, these are things that need to be changed now. And I think the statement that was issued by the Metropolitan Police, where they said you should run away, you should get on a bus, you should ring 999 and a whole load of other stuff. It was, that is completely not the only answer. Why on earth a police officer felt that they could do that, and of course most people do comply with the instructions of a police officer. I mean, I feel this particularly strongly because Sarah Everard, the friends that she was visiting were in Leithwaite Road, which is in Wandsworth, and she left that address to walk back through my constituency to go back to where she lived in the neighbouring constituency of Lambeth and Southwark. And I find it absolutely appalling that, I don't know precisely where the event happened, whether it was actually in Wandsworth or whether it was just over the border into Lambeth, because there's actually a bit of a parts of the common, which is there, Clapham Common, are actually in Wandsworth. Parts of the common are in Lambeth, but actually Lambeth manages the whole of the common. So it's one of those slightly complicated. It's a bit like Wimbledon Park is partly in Merton and partly in Wandsworth, so which you probably know better. But I find that absolutely appalling that she may have been, in my view, effectively abducted by a police officer. I mean, that is what happened. And then, we all know the outcome. It was unthinkable. So I think everybody in the police needs to be issued with, they shouldn't be doing it anyway. The fact that they feel that they can do it with impunity, the fact that we've now discovered that these WhatsApp groups where, they were regularly exchanging pornographic images, the fact that his nickname was the rapist, and people felt that that was acceptable, and the fact that, you know, there was a woman on Sky Television only this week in the news who was a police officer saying, well, I reported some of these things the very next day after I reported them, I had my you know, my new appointment was withdrawn from me, you know. So the whole culture, that's why that needs to be tackled so urgently. That the fact is, that's the only way you can stop people feeling that they can do that. You've got to tackle the whole culture, because the whole thing about it's just one or two bad apples in the barrel, clearly the bad apples in this barrel, and of course, you know, and if you're in the police, no wonder they will be making statements about ripping their hair out, because it does mean that they are all now viewed with a degree of more suspicion. I mean, they're already, you know, and we have to face the fact that there are already communities that were viewing the police with heightened suspicion anyway. I used to ride a motorbike, and I used to get stopped by the police all the time because I'm 5'3". And when I was younger, I was also very, very tiny. They obviously thought I was a young boy who'd stolen the motorbike, and they would stop me. And every time I opened my crash helmet, I think this is when I started wearing bright red lipstick, they would then do a double take and look shocked, because I was then very clearly not the little boy who'd stolen the bike, but was a woman. So I ended up just carrying all my documents with me everywhere I went, so that, you know, and that's the trouble with them, is they fall into these assumptions, and they need to be challenged about those unconscious biases all the time. Now, you can laugh about mine because I was, you know, being mistaken for a little boy, but when they stop people because they're black, so they must be a drug dealer, or they don't respond to a woman because it's just a domestic, or they don't stop young men being murdered in a graveyard because, oh, well, it's just their lifestyle and they choose that. That's when it's actually much more important than, you know, mistakenly always assuming that I was a little boy because I was on a motorbike and couldn't possibly be a woman riding a motorbike. But that's what it's all about. It's unconscious bias. It's got to be tackled at the police end, not about issuing statements to women about what they should do.
Thank you so much, Leonie. I think we'll leave it at that unless there are any other questions. And thanks again, Leonie, for your excellent presentation. We look forward to seeing you again at our next meeting. And if we can move on now to agenda item 4, local cancer services. And I'm going to ask Dr. Nadeep Alk, if I'm pronouncing it correctly, if you can actually do the presentation.
Hi, David. Thanks. That's a good translation. Thank you so much for giving me time to join you guys today. I'm Dr. Alk. I'm a GP in Merton, but I'm also the cancer lead for Merton, and I'm a Macmillan GP, so I also work with the charity Macmillan to drive change in cancer care. And I guess if we just go to the next slide, the agenda for today is mainly to update those on the call about current cancer care. There's been quite a lot in the media about a backlog of cancer cases. I think everyone is now quite well aware about the challenges, and to discuss where the problems are most felt, and obviously look specifically at Merton to see where we're at with our cancer care catch up, and to see what we're doing about it from a primary and secondary care perspective. Next slide, please. So just to give a very brief high level look at what the pandemic has done to cancer diagnosis and care in the UK. This chart looks at Southwest London. So Southwest London is involved in delivering care together. So Merton, Wandsworth, Kingston, Richmond, Sutton are all working together for some years now to deliver healthcare objectives. And so this data looks at some of the cancers where we found the pandemic has led to fewer diagnoses for. Number one on that list is urological cancers. So prostate cancer is a big player, and we know that this time compared to pre-pandemic, there's a significantly fewer diagnoses of patients with prostate and bladder cancer, and I will discuss that in a bit more detail. Breast cancer diagnosis is also really lagging behind, and that's been quite acutely discussed in the media recently. A lot of that is outside of GP's perspective, but it's mainly to do with the backlog of screening. And also in some boroughs in Southwest London, there's also quite a significant backlog with lung cancer detection. Next slide, please. So it's useful to benchmark where we are in Merton compared to other boroughs. And sort of there's some good and bad things when it comes to the statistics. So when it comes to prostate and bladder, Merton is actually not too bad. You know, reassuringly compared to other boroughs, if we look on the right of the screen here, we have the least reduction in diagnosis of prostate and bladder cancer. In terms of numbers in real terms, we're thinking there may be around 7 patients in the community in the whole of Merton who may have an undiagnosed prostate or bladder cancer. Obviously, even seven is too much, but you know, if we compare that to some of the other boroughs, you know, we are not too far off where we should be. Breast cancer, on the other hand, you know, Merton is struggling, as are most parts of the UK, with this. And so, if we look at that in terms of real terms, again, it's a lot easier to discuss it in numbers. There are probably around 25 or there's about women with undiagnosed breast cancer in the borough of Merton. And the reason that we think that there's been such delays is because COVID has a disastrous effect on breast cancer screening services, both from a delivery point of view, but also because patients have been more reluctant to go out and have screening tests done. Obviously, you know, worried about catching coronavirus in screening centres. And so the combination has led to quite a big backlog in the diagnosis of breast cancer. Lung cancer is a problem for some boroughs. Fortunately, Merton, again, we're not actually so acutely affected by this, and actually, you know, we're actually doing better than others if we benchmark ourselves to other boroughs. Next slide, please. Now, I think it's important to talk about urological cancers. We know that prostate cancer is particularly making up the bulk of the fewer diagnoses in Merton. And I guess I am presenting this in different parts of the borough, but I guess when talking to Mitcham Community Forum, we know that there's the demographic, there's a high proportion of Afro-Caribbean men, there's a lot of high proportion of Black men, and prostate cancer does affect Black men more so than other ethnicities. And so it's, you know, really important to emphasize, you know, collectively as medical professionals, but wider in society, to really emphasize patients to see their doctor if they have unusual urinary symptoms. So that thing includes things like blood in the urine, passing urine more frequently, pain when passing urine. And so, you know, that's acutely something that, you know, we all collectively should be aware of. Bladder cancers also seem to be much fewer than we should expect, and we think that's probably because of a bit of more online consulting. Perhaps healthcare professionals have not been dipsticking urine tests as much as we thought, and that might mean that fewer abnormalities have been detected there. Next slide, please. Lung cancer, I won't spend too much here because Merton is not that bad, but you know, clearly some areas of the borough there is a big problem, and again, the message is clear. You know, if you have a persistent cough for a sustained period of time, blood in the sputum, unexplained weight loss, you know, long-term smokers, it's important to see your GP. Next slide, please. I'll skip this slide, thank you. So it's important to discuss what we're doing about it, and cancer services involve both GPs, hospitals, cancer alliances, which are special groups designed to help deliver cancer care. So there's been quite a significant rollout of communications, both digital and non-digital, in Southwest London. TV adverts, internet broadcasts about the signs of cancer and when to see someone. Next slide, please. In terms of GP practices, we have access to some charities that help improve cancer screening. So cancer screening is all about discovering cancer at an earlier stage. And so we have a fantastic community links project where they offer callbacks to patients who have not had their cancer screening test, reminding them do the test, why it's important, but also providing multilingual support for patients whose language, first language is not English. There's all sorts of available resources to help those with learning disabilities, and also improve bowel cancer screening in the borough. Next slide, please. So as I mentioned, it's not just digital adverts. We have found that there's a proportion of people who may not get exposure to digital adverts. So we really need to have things in your face on the streets, and so there has been some investment into having these sort of adverts, on bus shelters, posters, to help with this. Next slide, please. So when it comes to prostate and bladder cancer, GPs in particular have had sessions to discuss doing more prostate cancer tests. So the prostate cancer PSA test is a screening test that GPs use, and we have been emphasizing that business as usual. It's important that when you're having a blood test and you're at risk group and you might have some symptoms, that you have a PSA test on that. Breast cancer, there's been a lot of work with the breast cancer screening hubs. They had opened up their services to have a more open and flexible booking process, just to help people who perhaps couldn't make a certain appointment times, and to prevent people from not attending and then having cancelled appointments. And there's ongoing discussions about whether to continue with that or whether to go back to a book system. Next slide, please. Just a quick summary slide to talk about all the public engagement events. And to be fair, this is one that we should add to this as well. Stephen is on the call, who's a colleague who's one of the leads in the CCG and has helped organize these events with GPs and commissioners going out in person or online to different boroughs to help promote cancer services. Next slide, please. So this is actually an event around Pollard's Hill, around Mitcham. It was organised by some of the practice around East Merton and supported by myself and Macmillan. It was quite a successful day. It was part of, I think, a family fun day. We had our own stall. A lot of interest was gained. A lot of people came up to the stall and took leaflets away and asked our GPs questions that they've always sort of wanted to ask. So we're planning to do more of these events. Next slide, please. And so, 6th of November, we do have another cancer awareness session in sort of North Merton. I think that sort of covers more of it towards Colliers at Wood End, to help promote our message. Next slide. So, I mean, this is just a quick summary of everything I've discussed. The important thing to mention is that if there are any events that you feel a representative from cancer services would be great to have, either to do a talk, to have a stall, and please do contact us. We're here to support, and that's our role, to provide a bridge between healthcare services, I guess, the council, the public, and just to form that loop where the communications are continuously spread around. So I'm here to offer my services any way that you think is fit. And next slide, please. Just a quick mention about what's happening with GP practices. I know there's intense media pressure about GP practices being closed and not being able to get appointments. I mean, GP practices are open. I can promise you that. We are working as hard as we've always worked. Things are a bit different. Sometimes GPs insisting on online and then face-to-face. It is challenging sometimes for some patients, but GPs are getting together in what we call primary care networks now, working together for the greater good. And so everyone's GP practice essentially will be part of a PCN. And if we go to the next slide, one of the big aims of the PCN is about early diagnosis of cancer. And there's a huge emphasis and work going on in practices to help diagnose cancers in an earlier stage, because that leads to better cancer survival. Next slide, please. And the things that we're working on are reviewing our referrals, cancer tests, improving screening, but also just continuing communications between ourselves so that a good practice can help perhaps a poorly performing practice to improve things. Next slide, please. So yeah, that's just a really brief high-level summary. I appreciate I've gone through quite a bit quite quickly. If there's anything sort of specific, please do ask away. Thanks,
Thank you,
Brent.
thank you, Navdeep. for that presentation, informative presentation. There are a number of questions that are going to answer up. So if I start with Councillor Fraser, Brenda.
Thank you, David, Chair, and thank you, Dr. Naveed. That presentation of Fun Day that you mentioned was actually put on by my church in August. It was attended by 1,647 people. I was there. And it was fun. It was really good because it had a lot of people from all over talking. But my point is, as a ex-nurse, nearly 30 years in the health service, prostate cancer and other cancers and other illnesses that affect men, it is said that men hardly ever want to tell anyone, let alone go to a GP about it. So I'm wondering if you've got any educational intervention that you're planning with your group to do for young men in particular, starting with colleges and then upwards, because it's far too late when they've already got the condition to be discussing it.
I mean, that's a really interesting point, and your experience, obviously being a nurse for that many years, is amazing, and obviously that event to organise that is great. I can see your point about trying to get the message in early. To be wholly honest, because we know that cancer, prostate cancer in particular, and bladder cancer is an older man's disease. We haven't really emphasised attending colleges. Because obviously those groups tend to develop cancers until 40, 50 years later. But I can see your point that perhaps getting the message in earlier is better than too late, because patients will then have a cancer which is advanced. I mean, I would love to be approached about attending an event with that sort of population, and if there's interest, I would love to contribute to that. I can't say of any particular streams where we've specifically gone into that target population, because I think obviously we always, I'm not a commissioner in terms of organizing all these events, but clearly we try and approach those who are affected most first, and obviously, but that sounds like a fantastic strategy to continue on, rather than just sort of spreading the message and catching up with cancer. Perhaps as a long-term strategy, that would be something to implement on a regular basis. I would love to sort of help out if there's any sort of avenues you think that would be appropriate for that.
Okay, thank you.
Councillor Macaulay.
Thank you, Dr. Naveed. You mentioned in the first screen that the local cancer services, which one of the areas which you mentioned was GP Grand Drive surgery, which is my local GP surgery. Can you let me know when these services are offered? Because I don't seem to have any knowledge of it. I think it's just a point of clarification.
Sure, Edith. I mean, I'm actually a GP at Grand Drive surgery. So when you said what services, what did you mean? Sorry, I just wanted to sort of, in particular,
you mentioned on the first screen that the local cancer services, are, in these various areas. Yeah. And I haven't come across, it in my surgery, which is Grand Drive surgery, which is just down the road from where I live.
What do you mean in particular? So I want to answer your question.
But I just wanted to know what days that these services are offered to members of the public.
So what we do when it comes to cancer screening is so if you look at the different cancers, so it's done by Cancer Service. So if you look at cervical screening, during the pandemic there was a big backlog in cervical smears. So if anyone who's not medical, a smear is a quick test that can be done in a healthy person to look for early signs of cervical cancer. And so there was quite a huge work done on calling patients who were in the categories, who specific age categories, to have that smear test done, in the practice or within our neighbouring practice. And as you live nearby, you'll know that the Nelson is a big practice nearby. And so there's a huge catch up on that. And actually, when we look at the data now, we've almost caught up to pre-pandemic levels, even better now, because there's actually a lot of funding towards it. And then if you go to other cancers, so bowel cancer screening, so I'm sure everyone's aware that when you hit a certain age, you get something through the post, a bowel cancer screening test, which and I hope I don't want to be graphic, but it just takes you take a sample and you send that off, and that can help detect early diagnosis of bowel cancer. And so in Grand Drive in particular, we have an administrative staff who works once a week to look through those who haven't responded to their test, and then to call them up to say, look, hey, you haven't done your tests. Is there a reason why? Please, can you do it? Because this will help, diagnose the cancer early. And then going through other, there's obviously each cancer pathway is unique and different. And obviously breast cancer screening tends to be slightly outside of the GP practices perspective, because that's done by local hubs. But clearly there is a lot of emphasis about women who may potentially have breast cancer presenting to their GP practice. So, I think most practices do try to obviously see any women with any breast symptoms face to face to examine and to exclude cancer. So yeah, I mean, there's also work in the background, which, to be fair, as an individual patient, you may not see the work of it. So the GPs are now working on improving their referral criteria. So when we have a patient diagnosed with cancer, we then go through the record to look through to say, could this patient have been referred earlier? Was there an opportunity missed? And then we bring that to a clinical forum where the GPs from different practices get together to discuss these cases. I guess that kind of things won't necessarily, as a patient, you won't necessarily see, but it's sort of background work to try and improve quality. I hope that's answered your question, but if not, you can always find me at Grand Drive, because yeah, I'm one of your doctors.
Thanks, Dr. Gina. Agatha?
Thank you. I'm quite amazed that even though there was COVID, that people with cancer or various forms of cancer were sort of overlooked and left, and basically we're now trying to catch up. I know a few people that were diagnosed initially just before the COVID as stage 1, where now they're stage 4 because we're left and not sorted out. And now, we're talking as if, it's a matter of fact that, we're now catching up, but people are dying. And I can't fathom how, as far as I know, I've got relatives in Europe where they were still looking after patients with all sorts of illness. And we managed not to look after anybody apart from COVID. And you couldn't get to see doctors. You're also talking about men with prostate, which is mainly sort of Afro-Caribbean men with prostate. But men in general don't like to go to see the doctors anyway. So if somebody decides to come and see a doctor and they say, well, we can't see you because of COVID, or they'll have a conversation over the phone, or they'll have a video conversation, that's not going to solve the problem. So, to me, this is a sort of catching up on things. Some of it's going to be too late. And what we're going to say to people, I'm sorry, COVID was there, so we couldn't look after you. Whereas other countries were managing to do the same thing. And people have died, and people are dying from cancer. I find it very sad, really.
Just to touch on that point, Agatha, so it's Stephen speaking. So, I mean, we definitely hear that point, and a lot of our key messaging is trying to reach out. So what we're doing is a multi-tongued approach. So it's not only sort of the communications that we're having now, but we're also trying to look into specifically some of the health inequalities data to try to identify some of these areas which contain or populated with some of the more harder to reach.
I hate that harder to reach
populations, of which you've mentioned some of them, or less, either harder to reach, or maybe in areas where the information about services, cancer services, or the information about any other sort of support is probably less in those areas. So we are working on with sort of analysts and multiple teams in our organization to try to get this information so that we can target these areas specifically and try to communicate with the various populations to try to get this key messaging out there. But there is, there's many different things that we are trying, and I know and I understand that some of the results of what's been happening is definitely not been ideal, and it's one of those things that the NHS as a whole has been having to try to manage with various different sort of conditions across various different areas, not only just cancer. It's the unfortunate issue
Just to add
with
to that,
COVID took a massive hit on basically everything. Are you on mute? No.
sorry, I think you went out for a bit. I thought you were done. Sorry, carry on. No.
No, I was just saying the issue with COVID, etc., it's taken a massive hit on all services across the NHS. Not some more than others, but not just cancer services. So there is a big piece of work that we're doing collectively with all areas in the system. So GPs to consultants, various national level to very local level on the ground, community services. We're working with literally everyone, and as you know, parts of the reason with issues with reaching out to patients is because of that fear with some patients about still potentially contracting COVID, but also there's also other issues with regards to staffing and workforce and demand. So we're working on various different aspects to ensure that sustainability and resilience is there in the NHS, but also we're identifying and trying to sort of be proactive in how we reach out to patients and target them and support them in the best ways that they can be supported for their care.
Thank you very much for that contribution, Stephen. I mean, the question of COVID is something that we never actually had background experience in order to draw on it. It came upon us, and we had to deal with it. And we've had these difficulties as a result. But I think the issue is not to dwell on them, but to actually try to address them as you're doing, Stephen, in the work you're doing. Yes, we're going to have to do a bit of a catching up business, but that's the way it is. So you just get on with it. Okay, are there any other questions? If not, I want to move on. Any other questions? Okay, Navdeep, thank you so much for your presentation and the good work that that you're doing. We need to be supporting it as much as we can. And where possible, we're actually going to join with you within the local communities to try and make sure that this information reaches out into all parts of the community, because there's a big job to be done in that respect. Okay, thanks so much. Okay, can we move on then to agenda item 5, the public health COVID update? Okay, Barry, you're going to do that?
I am, Councillor, thank you.
Okay.
Thank you, Chris, for putting the slides up. Firstly, thank you for inviting me back. I think I was last talking to you back in February, which seems like a very, very, very long time ago. But again, just to say that clearly I have the pleasure of talking to you today, but the COVID response is very much a partnership approach. So it's the local authority, it's the local NHS, it's the voluntary and community sector, our residents and our councillors. So I'm just kind of giving you an overview today. Next slide, Chris. So COVID update, what we've seen most recently is over the last few weeks, the number of new infections have been hovering. They've been staying pretty stable between around 200 and 250 per 100,000 residents. So what that means in real money, as it were, is around 60 to 70 new infections every single day within Merton. So that's where we are. But a note of caution that those levels are high, but we are seeing signals, and we have that level of concern. We're seeing slight increases in the number of new infections across the borough. And again, that's partially to be expected. So again, we've seen in the press clearly what happened in Scotland when schools went back. So schools have gone back, people are returning to work, people are mixing more socially now. And so we expected that those increases of the number of new infections, but we're watching this really, really closely to see if this is a significant, there's no exponential growth in those cases. We're kind of just slowly hovering along. But those infection rates in Merton are no dissimilar from the rest of southwest London, to reassure you, or the rest of London. But when we look at the data and we delve just a little bit deeper into the Merton data, what we can see, and I'm sure you will remember from previously, that we look at East versus West, the number of infections in the East compared to the West, and these two have been crossing over each other throughout the pandemic. So what we've seen, the most recent data, is cases are just slightly higher in the West than they are in the East. But again, these have been crossing over throughout the pandemic. The majority of cases, as to be expected, is in the younger age groups at this stage. So that secondary school pupils particularly, that's the age group that we're seeing high numbers of cases. And again, that's what we expected to see. This is the group that is not vaccinated as yet. And we are seeing a number of outbreaks in schools across the borough and across the rest of London. But as well as looking at the actual cases and the number of new infections, we need to consider the impact of those cases. And to do that, we need to look at the Nhs indicators. So again, what we're seeing in the new Nhs admissions is they're pretty stable. They're pretty, there's no exponential growth. There's no significant number of admissions like we saw previously in the pandemic. But as you've just heard from from Dr. Alg, you know, the NHS are exceptionally busy. They've got catch up. There are other respiratory illnesses, and it won't take much to overcome the NHS. So we've got that note of caution, and again, that will probably hopefully seep throughout the rest of the presentation tonight. But I'm really pleased to say that the death rate of COVID-19 is low, and that is because of the effectiveness of the vaccination program. What the national government has published is their autumn and winter plan. It's worth a read. It's a really helpful document to describe what the plan is now, Plan A, and that's around the importance of vaccination, test, trace, and isolate. Really clear messages. And again, coming to community forums, listening to your messages, your stories, your opportunities that you see for us to increase the reach of our messages, please do get in contact with us. But if Plan A doesn't go well, then the national government has announced a Plan B, and that's within that document, which is around clearer comms on the change of risk status, introducing COVID passes, lots in the press about those, which is not being put in place in England right now, mandating face coverings in some settings, and encouraging people to work at home. So again, the plan is worth reading through, and we use that to guide our response within Merton. Vaccination continues to be our front line of defence. I think this is really important for us. There are 4 parts to the vaccination programme. I'm not going to delve into too much detail on this because there's lots of information out there, and I can share it afterwards if you would find that helpful. But the 4 parts, the first bit is what we've called the Evergreen Offer, and that's continuing to offer everybody those first and second doses. It's never too late. There are many people out there that have decided just to wait and take that to see how it works with the vaccination program, and they're changing their minds. We're seeing those numbers of people coming back saying, actually, I declined previously, but now I would like to take my vaccination. So our NHS colleagues are maintaining that Evergreen Offer to make sure that we can pick up everybody and leave no one behind. The second part of that vaccination program is around the booster program. And the booster program is very much in response to the evidence that we're seeing about waning protection. And so there's a booster program for those most vulnerable and those priority groups that originally started with the vaccination. So those living in care homes, over 50s, frontline health and care staff, and those with underlying health conditions. So the booster jab, you will be invited when it is your turn to get that booster jab, and we would encourage people to take that up. I think a really important point to mention on the boosters, I've spoken about waning protection. The vaccinations continue to give very good support and very good, they're very effective at preventing severe COVID-19. So that's a really important message for us. The third part of the vaccination program is about the third dose. So this is different from a booster. So this is the third vaccination dose for those residents that might be immunosuppressed. And these residents, they didn't have a full immune response to the initial 2 doses of the vaccine. And so that's why this is called a third vaccination rather than a booster. So it's a really important program. And again, you'll be advised if you're eligible for that third vaccination dose. Excuse me. Final part of the vaccination offer, lots in the press, really important part of our program, and it's going to help us manage and prevent those outbreaks that are taking place across the country, is the universal offer for the first dose, or one dose, sorry, for those young people between 12 and 15 years of age. So the NHS are working incredibly hard on getting this program. It's going to start within Merton very soon. They're working with our amazing head teachers, school leaders, and the staff and the pupils to make sure that we've got a good, strong offer around that universal offer, and that's an important part for us. So then to move on to the kind of the things that we can do to keep ourselves, our families, and our communities safe. And so, because we know, we've heard it already this evening, that coronavirus does still remain a serious health risk, and we're advocating that cautious approach within the borough to help protect ourselves. So keep an eye out on those symptoms. So the three main symptoms that we are looking at are a new continuous cough, high temperature, or change to or loss of taste or smell. And if you see any of those symptoms, however mild, if you're not too sure, is this a continuous cough? Then we would say be cautious, stay at home and get a PCR test. Really important, because again, this is what breaks that chain of transmission. We would encourage everybody to continue to take part in regular, so that's twice weekly asymptomatic testing. I've got a bit of a prop, so I've got a box of 7 LFT devices here. And again, I know that many of you will be taking part in that testing regime. And it's a really important tool for us to do it. Again, there's lots of debate and discussion in the press about the effectiveness of lateral flow tests, but they're a key compartment, they're a key part of our toolkit. What they're really good at identifying those people with a high viral load. And that's those people that might be transmitting a lot of the virus and potentially infecting many other people without knowing it. So they're really good at that. And then on those tests, we talk about sensitivity and specificity. These are clinical terms, or terms that we use within public health and clinical terms. But the concern around false negatives, we heard a lot about the LFTs are not very good because they show lots of false negatives. And that's the reason why we encourage everyone to take part in regular testing twice a week, because it overcomes that limitation, that slight limitation. And we also talk about specificity. And specificity is the false positive. So you take an LFT and it says you're positive and you have the virus, but you really don't. There are a very, very small number of these false positives. But again, within the system that we have in place, if you get a positive result from an LFT, we ask you, and you must get a confirmation PCR test. So again, we've got ways to overcome the limitation of the tools. Really pleased to say, though, that we have a really good offer of lateral flow tests within Merton. We've got testing sites. We've got one currently at the New Horizons Centre, and Naomi and all the centre staff have been absolutely amazing in supporting us on that approach. So we're going to continue to have a testing site within the east of the borough. We're working on the details of that because Naomi wants to get her centre back for some business as usual. You're also able to collect the lateral flow tests, the box that I've just kind of waved around a couple of times, from our community pharmacies or from our libraries. So you can go to Pollard's Hill Library and collect a set of tests to take at home. The lateral flow test, last point I'll kind of make on this one is that in the most recent reporting period, there were about 15,000 LFTs taken within Merton. And of all those tests, 121 were positive. And that's a good program for us. That's really positive. These were 121 people that were asymptomatic. They had COVID. They were transmitting the virus, but didn't know. And so by taking part in the asymptomatic testing program, they got the positive test result. They got their confirmation test, the PCR, and then they were able to support and stay at home to break the onward chain of transmission. And it's those types of things that really do keep our communities safe. The other things that we can do to keep ourselves safe is, if you're not well, stay at home. Yeah, we're slowly starting into the flu season. If you've got a dripping nose and you've got a cold, please stay at home. Again, we don't want those illnesses to be shared with workplaces, colleagues, and with our vulnerable people. We've touched on this already in the previous comment around transport, but please wear a face covering in crowded places, and that protects other people. And if you are meeting people, meet up outdoors, like Leonie was mentioning earlier about her meetings were outside, that's fantastic. But if you're meeting indoors, then open the windows and doors to get that ventilation moving through. Really important point is also that regular hand washing and use the NHS app. We're still maintaining the use of the app. It does protect us. It breaks that chain of transmission. And it's those type of messages that we can do in the community that I need your support on to make sure we're getting the messages out. We've heard, about the impact of cancers, and we've heard about smoking and things. But what we have in Merton, we have a campaign called Better Health Merton, and we're encouraging people. Now is the right time to make positive lifestyle choices, lifestyle changes. So to be a healthy weight, to move more, to take more physical activity, stop smoking is going to be really important for us. Reducing alcohol use, get your flu jab. Manage those long-term conditions, whether it's diabetes, etc., asthma, to manage those conditions well, because these are the things that are going to help protect us from severe COVID. And clearly making sure that we can look after our mental health and well-being. We have good services in Merton that you can access for the support to make these sometimes difficult changes. So again, we've got links that we can share with you on those services. Next slide, please, Chris. This is just an image. You'll see more of this soon if you haven't seen it already, but this is how the umbrella brand that we've pulled together for Better Health Merton to encourage people to lead healthy lifestyles. Next slide, Chris. So finally, from me this evening, opportunities for action. But first of all, I'll show you that the image on the right-hand side of the slide. We know that it's sometimes difficult to understand the different types of tests that are available. And so if you have symptoms, if you have those 3 symptoms we've spoken about, high temperature, continuous cough, or loss of change to your taste or smell, you need to get a PCR test. That's the test that you get. If you have no symptoms, twice a week you should take part in regular LFTs. And the reason that's a really important message to show the difference between a PCR and an LFT, a lateral flow test. But also that image was developed by our young Merton young adult community champions. The young people in the borough said, we're struggling to understand this. Can we put something together to help people to understand the difference? So that's just one of the images that our amazing young people have pulled together. So opportunities for you to support and help and guide. We still meet every other Wednesday night and at 12 noon with our COVID community champions. We've now got 170 champions. We have about 30, 40 people that drop in on a regular basis, and we send an email on a Friday afternoon with images and WhatsApp groups, etc., so that people can share the messages with their networks about lateral flow tests, where you can get your vaccination, the importance of boosters, etc. The second opportunity, and this is Thursday, so this is tomorrow evening, that our NHS colleagues are working on a vaccination Q&A webinar. So this is specifically for those parents and carers of those young people between 12 and 15. So you can go to that webinar, that Q&A session, and you can ask any questions that you might have about that 12 to 15-year-old vaccination program. So again, we can share that link with you so that you can attend and share it with your networks. Another opportunity, and what we're reflecting back on, is that we know within Merton there are 14,000 of our residents that were clinically extremely vulnerable and asked to shield. And that was incredibly difficult, and that had a significant impact on those people, on those individuals and their families in the communities. And that was put in place to protect those individuals, but it has had a negative impact. And so what we're doing, we want to understand the challenges that those residents have had so that we can support them going forward, because there is some residual anxiety about the opening up of society. So again, we've got some sessions where we can listen to our clinically extremely vulnerable residents so that we can put things in place to support them going forward. If you work with or on behalf of organisations, there's funding available to help the COVID response. So Merton Giving, so that's a partnership grant fund from including the All England Tennis Club, the Borough, the NHS, voluntary sector providers, etc., have come together. And so there's money available for small organisations to bid for to help us with our COVID response. And the next deadline is the 6th of December for that. Finally, please sign up to the Merton COVID-19 newsletter if you don't get it. This comes out every Friday, and it's got those key messages around how to keep ourselves safe, any updates, and how we can work closely with the community to reduce the risk of COVID-19 going forward. And as always, you can contact us in the public health team, or you can contact me and I will answer any questions that you might have. Next slide, please, Chris. Thank you, Chris, and I'll hand back to Councillor Chung.
Thank you so much, Barry, for the excellent work that you're doing, and we thank also all the people and the NHS for the hard work that they have actually been undertaking during this very demanding time. I think Edith wants to ask a question.
I just want to pass a comment to Barry. I just want to say thank you, Barry, to you and your team for all what you have done in the last 18 months. It's been a really good, successful campaign in getting people to take the vaccine. And I also want to endorse the reality of you talking to our voluntary sectors in the borough, which has helped quite a lot in terms of people we represent, because I have had a lot of people from my ward in Lavender Fields who have attended most of these Zoom meetings, and they're very happy about what's going on. Finally, I would also like to thank your team for last Sunday in attending the Mayor's Silver Sunday at Mitcham Football Club, where they gave rapid test self-testing kit, I think about 80 to several people who were there. That was really amazing. Thank you so much. And I think most of the older people who were there were delighted in taking 2 and 3 kits. So thank you very much.
Thank you, Councillor. That's really nice to hear. And again, what we've seen throughout the pandemic is that the really good, the strong voluntary and community sector has really stepped up and been a wonderful part of our pandemic response within Merton. And we're doing more of it. So we've just agreed a significant grants programme to go into a number of BAME-led organisations within the borough. So we're working with BAME Voice, the Association of Polish Families, so that we can continue to working with those voluntary sector organisations. And also to provide some funding so that they are around the table for recovery discussions as well as COVID response. So we're going to do even more of that, Councillor Macaulay.
Thank you so much, Barry. For the excellent work that you and your team are carrying on. Okay, I'm going to move on now to agenda item 6, the Rome Community Facility update. And I think there's also an update on the Mitcham Bridge. James, I think you're going to actually provide us with a response to this.
Thank you. Yes, thank you, Chair. Thank you, David. If I take the surgery first and then come on to the bridge. And of course, when we talk about the surgery, we also need to reflect that includes both the surgery and its associated pharmacy, but also the community facility and Scout Hall as well. This is one, and apologies if anybody who attended the meeting on Saturday, that I hope I'm not going over too much similar ground, but this is one where there's been a significant delay in bringing forward the health surgery and the community centre. In physical terms, they're both linked, and that's why one can't happen without the other. It was a planning Section 106 planning requirement, and there's been a lot of very enthusiastic and detailed work that's been undertaken by the local community on progressing with the works to the community facility that have been put in abeyance because of they're wanting to know that this is really happening. And with the health centre, really it was working with Merton CCG as now is to make sure that they had all of the processes lined up to both agree the specification and the funding for the health centre. As of 2019, there was a real concerted effort to get the building built. The frustration of local residents was very evident, and the developer is Crest, who built out the housing, but they also are working with a company called CSM Development, who will actually run and manage the surgery, which is not an unusual practice for the delivery of new facilities. The work was underway to do some cost revisions to that and cost savings that resulted in a revised planning application, which simplified the doctor surgery in particular. It was items like over the period of time, the range of activities the health facility would run didn't include equipment that carried such heavy loads, so they were able to re-engineer the building because it wasn't one that would take very heavy equipment on upper floors. That then resulted in a fresh, a revised application to do some minor amendments, and that was approved by the council some 18 months or so ago. The work to take that forward was round about the same time as the start of the first lockdown, and during that initial period, Crest Nicholson furloughed most of their staff, and all of the staff working in the office associated with this part of London and on this project were furloughed until relatively recently. They then started cranking up the machinery probably about in spring of this year. That resulted in working with CSM and indeed with the support and very much the input of the local practice that will take over the new surgery to make sure that it was designed to a specification that they were happy and was right for the local community. The first cut of that unfortunately wasn't good enough. There were some issues around things, particularly around noise insulation. I'm sure everyone will appreciate that when we go to our GPs, and we will, regardless of the future, we will continue to have face-to-face GP surgery meetings, that you need a place where you can speak in confidence and knowing that you can't hear it in the next room. So some errors that had to be rectified, those are now being dealt with. There's a revised plan that's been submitted to CSM because it's got to also meet their standards, and we're hoping that is signed off over the coming weeks. At that point, it'll be taken through the approvals process by the CCG, and we'd look to have a start on site. The build out period is probably 12 to 18 months. So if the current specification is agreeable, if the funding's signed off, then we should be starting on site probably sometime early 2022. The building out of the GP surgery will also result in the building out of the community facility, and at that point, we'd want to work again with local residents to build up the business plan and the works to that building, so that it was one that was a really super opportunity and fit for purpose for local residents for now and into the future. So I think the summary of that is there's been quite a number of hiccups en route. The situation now is that there's a revised planning approved scheme. The specification to actually construct it is being finalised. If that is the case, it will go forward for approval. All of the sort of contractual obligations will then be passing through. There's probably about 4 different organisations that are sort of back to back on this. Crest will build it, CSM will operate it, the CCG will fund it, and the GP practice will operate it. But those are all being lined up as we speak. So the real objective is to make sure that the current specification is sound and can be signed off. David, I don't know if you want to take any sort of queries on that one, or will I go on to talk about the bridge?
I think if there are any questions on this, if we can take that first and then go on to the bridge. So, because I suspect that this has had quite a bit of work already. Maybe there may be too many questions this evening. Anyone that wants to ask any questions on this? Doesn't seem like it. I mean, I think what I would want to say very briefly is that this has been a long time in its nurturing. And I think we've had a lot of work done within the community. And I hope that, we're going forward now, and it's actually going to end in with the building in 2022 and the completion, because I wouldn't want the residents to be disappointed again. I mean, there's been so much frustration around this. So let's hope that we can move forward on it now. Okay. James, if you can move on to the bridge.
Thank you, David. The Mitcham Bridge, Bishopsford Bridge, as was, I think to be known into the future as Mitcham Bridge, as many people are aware. We know of the events in 2019 when the bridge actually collapsed during a severe weather event, very heavy rain. During that period of time since then, what the team has been doing is having to, first of all, they had to assess and shore up the bridge to ensure it was stable enough not to collapse. Following that, and that was a no mean feat. Then there was a process of redesigning and seeking planning permission for the new bridge, procuring a firm Land and Water to construct it, and then getting on site to do that. And that's been taking place over much of the course of this year. I was down there earlier today, and if you were to visit it, you'd see that actually there is a road that goes from one side of the bridge to the other, and the actual team are in the final throes of finalising the bridge, the platform, the railings, the cycle lanes that will go into it, and it will open very soon. In tandem with that, there'll also be the works to a wider cycle footpath, and also because it was necessary to remove some trees during to allow for the construction of the bridge, we'll be replanting 27 trees there in due course. We hope very soon to have all of the works finalised. It's likely that the bridge will open while there's still the odd piece of work, which is not sort of material in terms of construction. And then in due course, we'll remove the other traffic restrictions in the area, the rerouting of the buses, etc. So we've got a bridge that is, in terms of structure, is in place. It's now sort of the surface works that you see going on. There is a road in place. The pavements are being built out as we speak, and then it'll be a case of going in, putting the road markings in, putting back railings, etc., and you'll have a replacement structure.
Okay, James, thank you very much for that. Are there any questions that anyone wants to ask on? Oh, yes, Father David.
Hi, can I just ask James if we are going to see the bridge opening this side of Christmastide?
Yeah, I'm confident that we will. I think that we've had a very challenging but very sort of well adhered to by our contractor construction period. We've had a few supply chain issues, but they've been minor. But we've also had some utility issues. But where we are now is all of the utility works are completed, and all of the, if you like, the third party interest in the bridge are off site. So we've got one where effectively it is just finalising surface treatments, etc. And that should be in place well before Christmas.
Thank you. Could I just ask one supplementary as well? And that's concerning the loss of a wall, which was considered to be quite significant and important, which actually protected the actual river side from the road itself. Is the planting that you're talking about, the additional trees and that, is that going to actually include some way of actually recreating some of that sort of masking from the road itself, so that in actual fact that very pleasant part of Parkland is not just going to be sort of left open with raucous noise of traffic going up and down, as no doubt it will do as soon as it's reopened?
Yes, so the tree planting was both by way of replacement, but also to act as an acoustic barrier as well. So it will have an aesthetic as well as air quality, as well as an acoustic benefit.
Thank you.
Right. Could I just ask, may I ask a question?
Yes, Susan.
I asked the original question about when the bridge might be open, because I have a friend who lives very near there in Seddon Road, and she thought that the special bus service which had been provided had actually been withdrawn already. Can you tell me whether that's happened?
So not to my knowledge. It's something that you know, it won't end until the bridge is opened. But Susan, if you'll allow me to check on that, just to make sure nothing has happened that we are not aware of. But I was there today and actually saw the buses, the diversion buses going down the diversion route. So I don't believe that's happened, but I will check and come back via Chris to make sure I let you know.
Okay, so there was a special bus just from Rosehill to Morden to give people,
that's right,
you know, who were sort of stranded, access to Morden. Yeah,
yes, I'd very happily check and come back to you.
Yeah, thank you.
James, can you tell me about lighting in that area? Because we did a bit of canvassing and there were people worried about lighting in the walkway where they can actually walk. They said it's a bit dark there. So if the bridge is going to be opened up, what's going to happen to the lighting of the area? Because people are quite fearful, especially the young women there, because they said it's quite walking there is quite creepy. So can you let me know what's going to happen, whether there's going to improve lighting or what?
Oh, and then to be absolutely honest, Agatha, I'd want to check on that for you. Initially, what we had was requests for additional lighting because of but because of its proximity to the park, what we needed to do was to get suitable lighting that also made sure it worked with the wildlife, for a sort of a very generic term, to make sure that it didn't impact on those. But so let me check on that. There wasn't any reduction in lighting, but and the enhancements are sometimes very difficult in green space areas because of that knock-on impact on the wildlife. But again, I will check on that. And I think, you know, as discussed previously in this meeting, you know, we need to see what we can do to make sure that we give people that sense of well-being in the area for community safety.
Yeah. Okay. If you can get back to me, James, I'll be grateful. Right. It's the walkway, you know, where the path where they walk down, where the road is closed. It's just dark. The women there said it was quite dark, and they found it quite alarming. So yeah. Thank you.
David, you're on mute.
Sorry. Thanks, James, for your presentation. And we look forward to further developments in both of these areas in the near future. Thank you. Okay, we've come to item number 7, which is the last agenda item, and it's the open forum. So if there are any questions that people want to raise here, could you indicate, please? It doesn't appear that there's any questions. Given that we had such a comprehensive agenda, I'm not surprised. However, I just want to make a comment. Oh, Agatha, you want to say something?
I just want to make a comment to Jane about the Christmas lights. I gather you got my email. So if you get back to me, then we'll know where we go from here. You're muted.
Apologies. Like Christmas, we always look forward to Agatha's autumn request for the lighting. And just to reassure you, Mitcham Town Centre will be getting Christmas lighting, but I know that you want to have a chat about what the scope of that may well be.
Yeah, great. Thank you.
Thank you for that. Okay, there are no questions on the open forum. I just wanted to record a comment in the open forum. Since I've actually been chairing the Mitcham Community Forum, we've been constantly trying to raise the agenda of the Wilson Hospital. It's not the Wilson Hospital per se. The issue is more to do with the question of the disparity between health inequalities in the West and in the East. It's not because people aren't here, but because during my rounds in my own ward, many people ask me about the matter to do with health equality and the Wilson. So it's actually a big agenda for the community, and I want to put on record that we hope that there be something coming forward in the not too distant future in respect of this particular urgent matter, because every day that goes by, right, is a day too late for some people. Because health equality means that some people die earlier than others, and they die earlier in the East than in the West. And just for the simple fact, it's only recently that the government is now actually going to set up a new office for health to address these issues. And there's not a lot that's needed doing in order to close the gap. Right? We just need to get on with it. So I just wanted to make a note of that. Okay, since there are no other agenda items and no other questions to be asked, I think we've come to the end of a very productive evening. I want to thank everyone who's attended and participated. I'm going to close the meeting now. The next meeting will be on the 22nd of February. It's away, but in the meantime, have a good rest of the evening, and I look forward to seeing you then. Thanks.
Thank you, Chair.
Thank you, Chair.
No problem.
Bye-bye, folks.
Thank you.